Hello, my name is Khadijah, and I'm presenting a case of suspected appendicitis for evaluation and possible surgical intervention. The patient is a 46-year-old male who presents with progressively worsening abdominal pain, which started in the periumbilical area and has now localized to the right lower quadrant. The pain is described as a sharp and constant pain. He rates it a 7 out of 10 in severity, and it is aggravated by movement and palpitation. He also states that his symptoms started about late last night around 11 p.m. And he has noted to have a low-grade fever of 100.3. He denies any significant changes in his urinary habits or recent travel history. Regarding the patient's medical history, he was diagnosed with hypertension about 3 years ago. Otherwise, he has no significant health history or gastrointestinal issues. They have not experienced, the patient has not experienced any issues like this before. He has no known drug allergies, and he has not had any major surgeries in the past. Upon physical exam, the patient appears to be moderately distressed due to pain. Vital signs, his blood pressure is 163/76, heart rate is 112, respiratory rate is 22, temp is 100.3, and O2 saturation is 98% on room air. We've conducted several diagnostic exams. He presented this morning around 9 a.m. We did get a CBC, which showed mild leukocytosis with a white blood count of 13,000, which suggests an inflammatory response. His chemical panel was within defined limits. We did a urinalysis, and it was negative for infection or hematuria. We did an ultrasound which revealed a non-compressible enlarged appendix with some surrounding fluid, which raised a concern for appendicitis. Given the clinical presentation, physical exam findings, and the diagnostics, we highly suggest acute appendicitis. We did prescribe the patient, before going to get his ultrasound done, Norco 10 milligrams per 325 every 4 to 6 hours for pain, and we also prescribed Zofran sublingual for nausea. I called the patient with the lab results and the ultrasound results and told him to go to the nearest emergency department as soon as possible for further evaluation. He states that he is stable right now, and he lives about 5 minutes away from the closest ER, and his wife will be transporting him to the ED. Thank you.